look at an important topic, that is the normal ECG waves. So under the normal ECG waves, we are also going to look at what kind of interval does it involve. So first, we are going to start with the P wave or the P interval. P wave or the P interval. So the P wave or the P interval, it correlates to the atrial defibrillation, depolarization. So P wave, if you see, it is the atrial depolarization. Next, we are going to look at the QRS. So what does the QRS indicate? So QRS complex is up to, you can say, 0.10 seconds, and the QRS, it stands for the VD, that is a ventricular depolarization. So after the atrial polarization, depolarization, ventricular depolarization, next we look at the ventricular repolarization. So this T wave stands for that is the ventricular repolarization. So after the T wave comes the U wave. So what is this U wave related to? So this U wave is nothing but the repolarization. So it is the repolarization of what? The repolarization of the ventricular myocytes. Repolarization of the ventricular myocytes, and this is with a long action potential. Next, we'll move on to the PR interval. So the PR interval, it is about 0.12 to the 2 seconds, and here the physiologically it correlates to the atrial depolarization, AD, as well as and the conduction. Relates to AD as well as the conduction through the AV node. So the PR interval is done. Next, we are looking at the QT interval. The QT interval, it goes up to 0.43 seconds. And what does this indicate? 0.43 seconds. So this physiologically, it correlates to the ventricular depolarization as well as the ventricular repolarization. So VD and VR stands for the QT interval. Next, we look at the ST interval. So ST interval, the average is 0.32 seconds. So this is nothing but in other words, there is a QT minus the QRS. So what does this ST it refers to? So the ST, if you see, it is nothing but the plateau. It is a plateau portion, and this is of the ventricular action. This is of the ventricular action potential, and it includes the ventricular repolarization as well. That is ventricular action potential plus the PR. Next, we'll move on to the ST segment. So looking at the ST segment, this stands for the plateau portion. So this is nothing but the plateau portion, and this is of the ventricular action potential. So we have totally discussed the E wave components and their physiologically, it's what it correlates to. So now let's briefly draw the diagram. So this is P wave. Next comes, there's a small dip, then QRS, then there is T wave, then it repeats. So this was the structure. So this is P, QRS, and this is T. So this is what we dealt with. This is the PR interval. Next, this was the QT interval. So this was about the ECG wave and the physiological correlates. And to learn and grow daily like this, please do subscribe.